Asthma. Now, asthma is a condition that affects the airways, the small tubes that carry air in and out of our lungs. Now, when a person with asthma comes into contact with something that irritates his airways, such as an asthma trigger, and these could be things like chemicals, pollen, even exercise, cold air, and some foods, plus a few other things as well, they can then have an asthma attack. Now, an asthma attack is caused because the muscles around the walls of the airways tighten, so the airways become narrow and the lining of the airways becomes inflamed and it starts to swell. Sometimes sticky mucus or phlegm builds up so that they can further narrow the airways. So rather than being nice and wide, they become narrow and irritated, making it very difficult to breathe and leading to symptoms of an asthma attack. Now, we normally know someone's having an asthma attack because they have a very distinctive wheeze. They'll be struggling to breathe. They might go very pale in colour. They may be just complaining of pain in the chest as well. Because asthma is not the problem breathing in, it's a problem breathing out. 5.4 million people in the UK are currently receiving treatment for asthma, and out of that number, around about 1.1 million are children. It is quite common, but it is a very serious condition, because on average 2,000 people die of asthma a year. And just because it's common, it doesn't mean it shouldn't be treated seriously. It should be treated seriously. Asthma, unfortunately, can kill. And no matter how careful an asthma sufferer is about taking their medication and trying to avoid those asthma triggers, they can still have an asthma attack. Now, asthma sufferers tend to have two types of medication. They carry two inhalers. One is a preventative, which they will take probably morning and night, and one is a reliever. Now, the preventative is normally a steroid and it's normally a brown inhaler, whereas a reliever is normally a blue inhaler and it normally has something like salbutamol inside. But the drugs in these do vary, and there's now, of course, different types and different colours around, and they're normally combination pumps. Asthma sufferers having an attack, they should use their own pump, not anybody else's. Two reasons for that. One, cross-contamination between the inhalers, and two, it could be a different medication inside there. Now, sometimes you might find an asthma sufferer has a spacer that they can use, and they should be encouraged to use that. So let's have a look at what we do if someone starts having an asthma attack. Every asthma sufferer will react differently to an attack. Some people want to sit up, some people make a tripod kind of position over a table, some people want to put their hands behind the head. We should always be encouraging them to open their chest cavity up. We don't want them curled up in a ball. And we're going to make sure we loosen tight clothing. We're then going to encourage them to take their inhaler. Now, with the inhaler without the spacer, we're going to encourage them to push down on it and breathe in and take one puff every minute. After 5 minutes, if they're not feeling better, then we're going to call the emergency medical services and keep telling them to take a puff every minute until the emergency medical services actually arrive on scene. So let's have a look at how we'd use the inhaler with the spacer. Now, an asthma spacer is like a large plastic or sometimes medical container that has a mouthpiece at one end, and at the other end it has a hole where the inhaler will be inserted. Now, they only work with the aerosol inhalers, the pump ones, and they're designed to give an exact dose of medication into the lungs exactly where it needs without getting stuck in someone's lips, tongues and teeth. And it's actually a lot better for them because asthma sufferers using just the pump by itself can get side effects such as oral thrush. Now, some spacers just have a mouthpiece, but some actually have a face mask. And face masks tend to be used with people that struggle to hold it in their mouth. So let's see how we're going to use it then. So first of all, we're going to take off the cap of the inhaler, give it a good old shake, stick it into the end of the spacer, get the casualty to breathe out for as long as they feel comfortable, and then put the spacer in their mouth, in between their teeth and their lips, making a nice tight seal so no medication can seep out. You're going to then press the canister of the inhaler to put one puff of medicine inside the spacer. Then you're going to encourage the casualty to breathe in slowly and steadily, not hard and fast. You're then going to take the spacer away from the mouth, away from the face, depending on the type of spacer they have, and get them to hold their breath for 10 seconds, or as long as comfortable for them, and then breathe out slowly. Then if they need a second dose, wait 30 seconds and remove the inhaler from the spacer, give it a shake, and repeat the steps again. After its use, we should always make sure we clean the spacer thoroughly. Now, just a few things about asthma. Please never leave someone suffering from asthma by themselves. Please also don't tell them to go anywhere where it's cold. Cold air, as we mentioned before, is an asthma trigger. It can make an asthma attack worse for them. Their chest will already feel tight. Imagine you walking up a hill on a cold day. Our chest gets tighter. Imagine if it's tight already, now you're making it a lot worse for that person. So if you're a childminder, nursery work, you need to make sure that child has their own medication with them, because you never know when they might need it. Don't forget to hit that subscribe button as well, so you don't miss out on any of our videos. And please comment below